KTN News.
And in other news, Health CS Nakhumicha has suspended senior branch officials from the National Health Insurance over alleged links to cartels that could have led to the loss of public funds. Those affected include staff in Meru and Nairobi counties. The CS is calling on EACC to conduct speedy investigations on hospitals wrongfully benefiting from Kenyans' money. Now, NHIF staff will also now be subjected to a lifestyle audit. Beldin Waleaula with more.
For a few weeks, NHIF has been in the headlines for failing to pay hospitals and subjecting Kenyans to pain and suffering. As if that is not enough, NHIF is in the headlines again. After an expose of how hospitals have been defrauding the national insurer by preying on vulnerable Kenyans whose NHIF payments are up to date, Health Cabinet Secretary has unleashed her claws on the said hospitals who have been getting payments from NHIF by citing dubious treatments, yet they offered little to no service. Meru County was the main victim of the well-orchestrated scheme.
Had a meeting this morning with the chair of NHIF board and instructed him that they commence investigations.
The unscrupulous NHIF staff who are said to be working with the hospitals in Meru County and Nairobi to embezzle funds from NHIF have been suspended. The CS also said a lifestyle audit will be conducted on all NHIF staff to ensure all staff can explain their wealth portfolio.
All branch managers for NHIF in the affected areas be suspended immediately pending investigations. I hereby also instruct the Kenya Medical Practitioner and Dentist Council, the Pharmacy and Poisons Board, to commence investigations immediately and conclude within 48 hours on the following facilities: Jekim Medical Center in Meru Central, St. Peter's Orthopedic and Surgical Hospital in Kiambu County, Afya Bora Hospital in Mwea Kirinyaga, Joy Nursing and Maternity Hospital in Malewa Street, Kamkunji, Afya Bora Hospital Annex in Wanguru, Mwea, Jekim Hospital, Ngupu, Imenti South, Beirut Pharmacy and Medical Center, and Amal Hospital Limited.
The aforementioned hospitals by the CS will also undergo investigations, and if found culpable of defrauding NHIF, they will face closure.
Starting now, the facilities are directed to immediately transfer their inpatients and evacuate their process. This will allow KMPDC to commence their inspections.
The NHIF has been tasked to do an overhaul of verification of payments made and that they plan to make to avoid further loss of funds.
We are embarking on a verification exercise of all payments across the country to flag out any inconsistencies that may point to abuse of resources and theft.
On the other hand, those wanting to carry out medical camps should now get their permits from Kenya Medical and Dentist Council. She adds reforms and cleanup at NHIF will have casualties, but it will be for the better good. Belden Waleaula, KTN News.
Just ahead, the mystery of a missing head and why a family in Tarbo